Question 74. A 25-year-old female arrives at the emergency department with symptoms of vaginal bleeding, nausea, and pain accompanied by tenderness in the lower right abdomen. She has a past medical history of an open appendectomy due to a perforated appendix. Her vital signs show a blood pressure of 90/50, heart rate of 120, and respiratory rate of 25. What is the likely diagnosis? Option A, threatened abortion. Option B, complete abortion. Option C, ectopic pregnancy. Option D, abscess. The likely diagnosis is Option C, ectopic pregnancy. The symptoms raise suspicion for an ectopic pregnancy. The vital signs also indicate signs of potential hemodynamic instability which can occur in cases of ruptured ectopic pregnancies. Here's why the other options are less likely. Threatened abortion refers to vaginal bleeding in early pregnancy without any tissue passed from the uterus. Complete abortion involves the passage of all pregnancy tissue from the uterus. Abscess might cause pain and tenderness, but it doesn't explain symptoms and the patient's history. Question 75. A 60-year-old female patient has been diagnosed with type 2 diabetes. She initiated metformin treatment at a dose of 1 gram twice daily. After 3 months, her fasting blood glucose and random blood sugar levels are within the normal range. However, her HbA1c remains at 6.9. What is the most appropriate next step in management? Option A, consider raising the metformin dosage. Option B, introduce glimepiride. Option C, maintain the current regimen, no adjustments needed. Option D, evaluate the addition of a DPP-4 inhibitor. The most suitable next step is to evaluate the addition of a DPP-4 inhibitor. Explanation. Despite achieving normal fasting and random blood sugar levels on metformin, her HbA1c remains at 6.9%. To better control her glycemic levels, the next step would be to add a DPP-4 inhibitor. This class of medication helps regulate blood sugar by preventing the breakdown of hormones that stimulate insulin release. Adjusting the metformin dose, introducing glimepiride, or maintaining the current regimen may not provide the desired control, or could have potential drawbacks such as hypoglycemia risk or weight gain. Question 76. A 19-year-old male presents with sudden right testicular pain and nausea lasting for 5 hours, and a swollen, tender testis in a horizontal line with an absent right cremasteric reflex. What is the most appropriate definitive treatment? Option A, manual detortion. Option B, operative orchiopexy. Option C, antibiotics. Option D, analgesia. The most appropriate definitive treatment is surgical orchiopexy. This urgent intervention is vital to restore blood flow, salvage the affected testicle, and prevent complications. Other options like manual detortion, antibiotics, or analgesia are not suitable as definitive treatments for testicular torsion. Immediate medical attention is crucial in this emergency situation. Question 77. A 43-year-old man presents with a 1-month history of progressively worsening frontal headaches, intermittent falls, and blurred vision that is exacerbated when he bends forward. These symptoms also disrupt his sleep. There is no record of head trauma or seizures, and he experiences occasional head colds during this time of year. Based on this information, what is the most probable cause of his current condition? Option A, elevated intraocular pressure. Option B, irritation of the meninges. Option C, inflammation of the paranasal sinuses. Option D, increased intracranial pressure. The symptoms described are indicative of increased intracranial pressure. Conditions like idiopathic intracranial hypertension can lead to these symptoms. The absence of head trauma or seizures and the patient's description of symptoms interfering with sleep further support this diagnosis. Other options like elevated intraocular pressure, meningeal irritation, or paranasal sinus inflammation are less likely to explain the combination of symptoms observed in this case. Question 78. A 50-year-old man experiences reduced libido, difficulty achieving and maintaining erections, 5 kilograms weight loss, and bilateral gynecomastia. He consumes alcohol and has a blood pressure of 110 by 70 millimeters of mercury. His testes are small and firm, and thyroid hormone levels are normal. What is the likely diagnosis? Option A, chronic liver disease. Option B, testosterone insensitivity. Option C, adrenal insufficiency. Option D, exogenous thyroxine intake. The likely diagnosis is option A, chronic liver disease. Explanation. The symptoms are indicative of hypogonadism. In this case, the most common cause is chronic liver disease, which can lead to reduced testosterone production due to disruption of the hormonal balance and metabolism. The other options are less likely because testosterone insensitivity would typically manifest as signs of feminization in individuals with normal or elevated testosterone levels. Adrenal insufficiency generally doesn't cause the specific combination of symptoms mentioned. Exogenous thyroxine intake doesn't correlate with the observed symptoms. The patient's history of alcohol consumption in the presence of gynecomastia could suggest underlying liver dysfunction. Question 79. A 51-year-old woman with no unusual symptoms related to her colon has a medical history of hypertension. Her mother had colon cancer at the age of 85. Physical examination does not reveal any notable findings. During a colonoscopy, 2 small 8 mm hyperplastic polyps were removed. What is the most suitable next course of action in managing this patient's situation? Option A, schedule a colonoscopy in 10 years. Option B, arrange for an abdominal CT scan. Option C, consider mismatch repair genetic testing. Option D, conduct a fecal occult blood test in 6 months. The most appropriate step is to consider mismatch repair genetic testing. Explanation. The presence of a family history of colon cancer, even if it occurred at an older age, raises the possibility of hereditary colorectal cancer syndromes. Hyperplastic polyps are generally considered to have a low potential for becoming cancerous. However, the family history and the possibility of hereditary factors make it important to consider genetic testing. Question 80. A woman in her 20s presents with hair loss over the past 6 months, along with significant facial and back acne. She has a BMI of 33 kilograms per square meter, thinning hair at her forehead with a receding hairline, non-enlarged thyroid, and an obese abdomen without masses. The pregnancy test is negative, and her serum prolactin and thyroid function tests are within normal range. Considering her symptoms and findings, which additional test is recommended? Option A, oral glucose tolerance test. Option B, BRCA mutation testing. Option C, diagnostic laparoscopy. Option D, iron studies. Correct option is A, oral glucose tolerance test. The patient's presentation suggests the possibility of polycystic ovary syndrome, a common hormonal disorder among women of reproductive age. PCOS can lead to symptoms such as hirsutism, acne, and hair loss, along with menstrual irregularities and obesity. Insulin resistance and hyperinsulinemia are common in PCOS patients, which can contribute to these symptoms. The oral glucose tolerance test is recommended to assess insulin resistance, which is often associated with PCOS. Elevated insulin levels can exacerbate hormonal imbalances, leading to the symptoms observed in this patient. The other options are less suitable in this context.